The holiday season pressure is on to eat, drink, and be merry. ABC 7's Alex Redmond explains how overindulging may lead to a condition called holiday heart. Alex.
That's right, Haley. Even if you don't overindulge the rest of the year, you may want to curb your enthusiasm for holiday excess because it may impact your heart health.
Holiday heart is a term used to describe patients that around this time of the year tend to drink too much, eat too much, and have a sudden change in their level of physical activity.
Symptoms can almost mimic that of a heart attack, says Dr. Albert Avila of the Center for Urgent Care. A fast heartbeat, a hard time catching their breath, even pressure on the chest.
Holiday heart can be atrial fibrillation or an SVT. There's two different kinds of irregular heart activity. SVT, supraventricular tachycardia, a little different than atrial fibrillation.
The holiday season means that we are surrounded by lots of food that we normally wouldn't eat the rest of the year. And also there's a lot of drinking involved.
Instead of having a martini, I had 2 glasses of wine, and that's it. And then I tried to keep the food at a minimum.
I think normally we eat salads and vegetables and maybe fish, and we're very cautious because of his heart issues what we do eat.
Jeanette Zidane says she and her husband David are going to a cocktail party New Year's Eve, which involves heavy hors d'oeuvres.
Stuffed mushrooms and like pigs in a blanket, and yes, they're going to be gourmet hors d'oeuvres, but those usually have a lot of butter, pastries, things you just don't normally eat.
And you don't have to eat tons of food to overindulge, says Zidane.
You can overindulge in eating the wrong things.
The problem is when you overindulge, you suffer from that. And that's one of the things I don't want to do, is suffer from overindulging.
I think you just have to maybe eat the right things before dinner, and then when dinner comes along, be very picky.
Although uncomfortable, holiday heart doesn't usually stick around when we get back to our healthier routines.
Usually those symptoms can go away as long as people catch it early before it gets any worse.
But, explains Dr. Avila, it's very difficult for patients to be able to tell the difference between holiday heart and a bigger problem.
That's why it would be important, if they have these symptoms, to seek medical attention as soon as possible.
And although less common, excessive physical activity can also bring on holiday heart syndrome. So be careful when lifting up those grandkids and suitcases when you're traveling.
And we have a lot of stress because as much as we love our family, that can bring on some stress too. So,
lots of it.
Yes, try to be patient with all your family members. But Alice, what are some tips to help avoid triggering that holiday heart through what we eat and drink?
Well, one of the things that Mrs. Zidane said was make sure that you eat before you go to that party, and sometimes that's hard to do. But another thing that you can do is take little tiny samples of everything. Just take a little amount and put that on your plate, and just if somebody tries to pressure you, don't cave into the pressure, because guilt is a wasted emotion. You want to take care of yourself first, because they would feel far more guilty if something happened to you at their party than if you were guilty for not eating the food that they presented you with.
I like the moderation, just the little samples of everything. Yeah. All right, thank you, Alex.